Ladies and gentlemen, my name is Guan. This is Group 6 and our topic for today is narcolepsy. Now, narcolepsy is a chronic sleep disorder whereby a patient is unable to control his or her sleep cycles. Now, this is usually due to extreme sleepiness or sleep attacks. Unfortunately, it's not very common. It's actually a rare sleep disorder. Now, 1 out of 2,000 people actually suffer from narcolepsy. Out of those 1 out of 2,000, it's actually 70% out of those have an associated disease known as cataplexy. Now, like I said, it's not a mental illness. It is actually a rare nervous system disorder that affects your sleep cycles. Some people that have claimed to have this disorder is Jimmy Kimmel and Kurt Cobain. Now I'll pass the time to May to tell you about the causes of this disease.
Thank you, Guan, for your introduction. My name is May. I'll be talking about the causes. So the main cause for narcolepsy is due to a deficiency of the neurotransmitter hypocretin. Research found that normal individuals like us have about 70,000 of hypocretin-containing cells, whereas narcoleptic individuals have between 3,000 to 10,000 of these cells. Hypocretin is responsible for sleep-waking regulation. It is released during wakefulness and increased activity in target neurons that promote wakefulness and suppress REM sleep, rapid eye movement sleep. When one is in REM sleep, one is unconscious and is unaware of the surroundings. Lack of hypocretin results in lasting sleepiness and poor control of REM sleep. In fact, REM sleep can be so poorly regulated that the dreaming and paralysis that usually only occur in REM sleep can mix into wakefulness and cause cataplexy and dream-like hallucinations. People with narcolepsy inherit a gene that triggers the white blood cells to attack the hypocretin neurons, suggesting that narcolepsy is an autoimmune disorder. Another theorized cause for narcolepsy is traumatic injuries to parts of the brain, especially regions of the hypothalamus, which can indirectly or directly kill the hypocretin neurons at birth or after. An extensive loss of hypocretin is sufficient enough to cause the sleepiness of narcolepsy with cataplexy, which is why 70% of narcoleptic patients is diagnosed with cataplexy, as said by my former colleague. Some of the triggers for this disability are major psychological stress, hormonal changes during puberty or menopause, and even sudden changes in sleep patterns. An autoimmune attack can be triggered due to an infection such as strep or swine flu. Thank you. Now I shall pass it to Janav to talk about the symptoms.
Thank you, May, for that awesome elaboration on the causes and triggers of narcolepsy. I'm Jana, and I'm here to speak about the symptoms and risks. One of the main symptoms of narcolepsy is sleep paralysis, which is the temporary paralysis experienced right after waking up. They also experience a sudden loss of strength and muscle control, which will cause them to collapse anywhere, and this is extremely hazardous to their health. They also have this thing called excessive daytime sleepiness, or otherwise known as EDS, which will cause them to be sleepy during the day and unable to find sleep during the night. Aside from that, they also are exposed to sleep attacks, which are sudden bouts of sleep that are uncontrollable and could happen at any time, at anywhere. And this could jeopardize their health sometimes, as some of the risks that narcolepsy poses is that they might fall asleep while doing high-risk jobs such as being cops or firemen or construction workers. They also are unable to perform tasks that require constant attention, such as driving, flying, or even holding a baby. That's about all I have for risks. I'm going to pass it along to Kawe for associated diseases.
Thank you, Jenna. Hi, I'm Kawe, and I'll be talking about some diseases associated with narcolepsy. One of it, as said earlier, is cataplexy. It is a sudden loss of muscle tone which may occur randomly or when one responds to emotional stimuli. Laughter is reported as the most common stimulus and may result in the sudden buckling of the knee or even collapsing. People who have narcolepsy may also suffer from obesity as they are prone to gaining weight. Research shows that the deficiency of the neuropeptide hormone, hypocretin, which promotes hunger and wakefulness, may also cause them to lack the energy-burning brown fat. The next disease is insomnia. Narcoleptic patients tend to have fragmented sleep, waking up for 10 to 20 minutes several times during the night, which may only worsen their daytime sleepiness. Now, I would like to pass on to Caroline to further elaborate on other associated diseases with narcolepsy. Thank you.
Hi, I'm Caroline and I will now be continuing on with the topic of associated diseases. So other than the 3 diseases that was mentioned by Kawe just now, another disease would be depression. Symptoms of narcolepsy, particularly sleep attacks and cataplexy, can cause great embarrassment and wreak havoc on one's ability to live a normal life. Other than that, another disease would be sleep apnea. Sleep apnea is the obstruction of the airway that results in the stoppage of breathing multiple times in an hour of the night. It was found out that an individual can be diagnosed with narcolepsy and sleep apnea at the same time. So last but not least, the last disease that I'll be talking about would be Klein-Levin syndrome. So Klein-Levin syndrome and narcolepsy have many similar symptoms. Both of them typically impact a young teenager with hypersomnia, which is also known as excessive daytime sleepiness. However, the difference between them is that unlike narcolepsy, Klein-Levin syndrome can actually cause the patient to be actually psychotic and paranoid. And now I'll be passing it on to Kaivan to talk about the treatments.
Hi, I'm Kaiwan and I'll be talking about the treatment. Unfortunately, till date, there is no cure for narcolepsy. However, combinations of medication and lifestyle changes can help control the symptoms. Lifestyle changes include committing to a strict bedtime routine, avoid smoking, alcohol, and caffeine, as well as overeating before bed. As for the medications, the commonly prescribed drugs for narcolepsy are stimulants, antidepressant, and sodium oxybate. Stimulants help stimulate your nervous system, therefore it promotes wakefulness and alertness. Antidepressant, to state the obvious, treats depression. In addition, it suppresses cataplexy, sleep paralysis, and hallucinations. Sodium oxybate is an interesting one because it's known as the date rape drug, but it is considered safe to be used to treat narcolepsy if it's used responsibly. Sodium oxybate helps in diminishing sleep attacks. Even though all these medications can help control the symptoms, however, these medications might cause side effects. Therefore, the better choice is to maintain a healthy lifestyle rather than depending on medications.
Thank you, Kaivan. Now, like I said before, this is a rare sleep disorder. That's why we want to raise awareness, so that we can work towards improving the treatments for this disease. Now, for further inquiries, you can contact, email, or even visit Sleep Disorder Society Malaysia. My name is Tan Chang Guan. Along with my colleagues, Janar, Karwei, Caroline, Kaivan, and May, we'd like to say thank you.